Ulaanbaatar, Mongolia. An ambulance doctor and a driver working the same call. One has years of clinical training. The other, until recently, had almost none. This mission is closing that gap. Emergency care doesn't run on equipment. It runs on people. On whether the crew in that ambulance has practiced the same skill over and over until it holds under pressure.
So I think we can really work on helping them to help each other to develop. But I also think that enabling them to work as a team with their drivers is going to make such a big difference.
For the past every agency, every session.
Didn't know what to expect with working with drivers, providing them the first ever medical training for ambulance drivers in Mongolia. They are absolutely incredible. They're so inspiring because they really want to learn. They really want to engage in clinical practice. They're just sponges. Everything we demonstrate, everything we show them, they pick up very, very quickly.
Since 2017, 559 clinicians and first responders trained. 14 partner agencies. 70% of Ulaanbaatar's workforce trained. The target, full coverage by 2027. It didn't stop at the classroom door. Executive Director Professor Joe Acker and Chair Hamish McLean presented the case for reform to the Minister of Health.
They have a large supply of doctors right now in Mongolia. The graduates who have specializations in other areas but don't have positions immediately come into the ambulance services. We know from other Soviet countries that supply might not last, and there actually might be shortages in the future as the doctors do get jobs in the hospital or they have opportunities to go overseas, and we lose in Mongolia those doctors. So planning now for the future of the ambulance professionals is really important.
Instructors ride along on calls, watched last year's training play out in real time, on real calls. The mission made national headlines. The ambulance centre's own director spoke to camera about what's changed. Australian ambassador Leo Zheng came to see it firsthand. It's not just EMS Global saying this program works. It's a government watching it happen. This isn't about outside teams showing up with good intentions. It's about a skill that stays, that gets taught to the next person and the next. That's the difference between a visit and a system. Since 2017, that's been the goal. The numbers say it's working.
If you're enjoying this, consider subscribing so you don't miss future episodes.